eQuez. Your quest for education starts here. Welcome to eQuez Audio.
Hello, everybody. I'm Margaret Feldman, the founder of eQuez, a platform that helps students discover careers, find best fit schools, and make smart choices about higher education. This is episode 3 of Inside with eQuez, where we take an inside look at the journeys and lives of students and professionals who are studying to enter or work in a particular career. Today, we are speaking with Dr. Ebonie Vincent, a podiatric physician and surgeon, currently working in private practice in Orange County and Irvine, California. After listening to this episode, if podiatric medicine sounds interesting to you, visit eQuez.com, that's EQUEZ.com, to get connected to best fit podiatric medical schools. Dr. Ebonie Vincent earned a bachelor's degree in biology from Hampton University. She holds a master's of biomedical science from the Philadelphia College of Osteopathic Medicine and a doctor of podiatric medicine degree from Des Moines University. Since the age of 13, Dr. Vincent knew she wanted to become a physician. Dr. Vincent was an athlete her entire life and played Division I volleyball for Hampton University. The field of podiatry was an excellent fit for her as she could be a surgeon as well as practice sports medicine. She has found that the grit and determination instilled in her from athletics has proven to be an incredibly important skill set that she still applies daily. Having a strong sense of faith and family has also been instrumental in her success. Now, let's hear from Dr. Ebonie Vincent. Well, Dr. Vincent, we are so excited to have you on this episode of Inside with eQuez. Welcome.
Well, thank you so much for having me.
Okay, well, let's just jump right in. So how did you first learn about podiatry?
So I first learned about podiatry when I was in my postbac program at Philadelphia College of Osteopathic Medicine. I did biology as an undergrad at Hampton University, and I needed different credits and other classes to try and go into medicine, which was always my goal. And so in doing so, I did my master's of biomedical science degree. And that 2 years was a bit of a, experiment, if you will, I saw a bunch of doctors, from family medicine to pathology to pediatrician. And I actually found out about podiatry by going to one of the informational meetings at New York College of Podiatric Medicine. And, I was always that person that wanted to go into medicine, but it was very specific. I want to do sports medicine. I was very specific in my goal of what kind of medicine I wanted to be. And so when I learned about podiatry, it just seemed like such a perfect fit for me. Yeah.
So when you were exploring your interest in sports medicine, did you think about going the MD or DO route, or how did you get driven into the DPM route?
I did. So I went to an osteopathic medical school for my master's program.
Okay.
And at the time, when I was considering applying to the osteopathic school, it was a matter of how many slots are there open for DOs versus MDs in orthopedics? Because that was where I was headed. Like, I want to do orthopedics,
right.
So at the time, I don't believe that there was that many slots available. There was always a, I guess, gamble, if you will. To, sure, you can get into medical school, you can become a DO or an MD, but are your test scores going to be good enough? Are you going to match into the specialty that you want to be in? Right. And that was a little bit risky to me because I knew exactly what I wanted to do. If I was, matched into a different, medical specialty, I don't think that I would have been as happy doing that specialty as I would be doing what I wanted to do. So when it came to podiatry, it was almost as if like you picked early. You knew you were going to be dealing with foot and ankle. And that's, very specific in specialty in itself. But, you were able to be a physician treating patients in clinic, but there's also that surgical aspect to it that you can completely do as much or as little as you wanted to. So for me, it was kind of like, yeah, duh, that's what I want to do. eventually orthopedic physicians tend to specialize in certain parts of the body anyway, like a hand or knees or hips, things of that nature. And you do have your orthopedic doctors who specialize in foot and ankle, but with podiatry, you specialize earlier. I feel like you have more knowledge at an earlier pace. So it just kind of made sense for me.
Yeah. There was a level of reassurance that you had knowing that
Exactly.
if you went the podiatry route that you would be doing the specialty that you wanted to do.
Exactly. And that's the thing about podiatry. Like, you have to be sure that it's the field that you want to do.
What was your shadowing experience before you entered school?
Right. So after I went to that informational meeting at NYCDPM, they had a list of doctors there who were graduates of the program and who were also in the Philadelphia area. So I actually did my shadowing with a doctor. His name was Dr. Mangel. Okay. And he was very good. He was associated with Temple University at the time. And he was doing everything in terms of patient care. He was doing, your diabetic foot care. He was also doing children. He was doing a lot of surgeries in regards to bone lengthening. He was doing broken ankles, everything. So he was one of those physicians or podiatrists that pretty much didn't have a specialty, but it was great for me to see the wide range that podiatry could possibly do.
Sure.
I think it would, I didn't do this. I didn't shadow multiple podiatrists, but I think it would be beneficial if you do shadow multiple podiatrists because, you can see podiatrists that just does, just sees the elderly and diabetic Medicare kind of patients. And then you can just see a podiatrist that does only surgery. And depending on, your personality or your experience, you could love it or hate it,
Right.
So, but the beauty about podiatry is that you can essentially make it what you want to make it because at the end of your training, you'll be well versed in all of it. So,
right. So that actually leads to my next question.
Oh, yeah.
Is there a particular specialty within podiatry that you've chosen to specialize in, or do you do more general work, or what do you specifically do?
Right. So right now I do everything.
Okay.
In my mind, futuristically speaking,
yeah.
I would like to specialize more in sports medicine,
right.
Specifically for women.
Okay.
I was an athlete my entire life. I played volleyball and athletic women and things of that nature have a special place in my heart. So that's kind of where I want to focus my expertise with women in athletics, any soccer players, volleyball players, basketball, dancers, cheerleaders, any woman who is, active. That's kind of where I want my specialty to lie. But right now it's everything. My practice is fairly new. So I see it all.
Sure. And did you, I know you mentioned this before, being interested in sports and being an athlete. Did you have any experience when you were growing up where you injured your foot that sort of exposed you to the profession or what happened?
Yeah. Yes, I did. Well, not exactly my feet, but I have early exposure to surgeries on both of my knees. I had ACL reconstruction on both knees. Once when I was in 8th grade and once right after I got my volleyball scholarship when I was a senior in high school. So that was, that was a very terrible experience, which taught a lot. Thankfully, I came out of that experience pretty great and I can relate to patients because of that experience. So I was introduced to my orthopedic pals earlier on in my life.
Yeah.
So that's what kind of ignited the passion for, my wanting to become a medical doctor with surgery and, and clinic. Cause I really liked the way that I was treated as a patient from my orthos. So, it just kind of translated into passion for me. So
something good came out of
something
not so great experience.
Nobody wants knee surgery. It's horrible, but
Yeah. I have not had any, but I can only imagine that was not fun in the midst of your volleyball career. So.
No, it wasn't. I had to redshirt my freshman year of college, and that was a whole thing. I had to pretty much reinvent the wheel, so to speak, with me playing for Hampton. So, but thankfully it turned out to be great. I played for 4 years. It was all good.
Good. Okay. Yeah. Do you think there are any misconceptions about podiatry out there?
Yes, I do. Actually, when I first started podiatry school, there was this whole initiative out there of Mission 2015, where all podiatry schools needed to be associated with a MD or DO school. And the reason being is because not a lot of people, even within the medical profession, knew a lot about what podiatrists are capable of doing. They don't know what our educational background was or is now. They don't know our extensive residency training or board process. They didn't know a whole lot of those things. So when people don't know, they kind of assume too much.
Yeah.
So basically the mission of 2015 was to associate more medical doctors and doctors of osteopathy with podiatrists, so that we can have more of a continuity of care, more of a interprofessional kind of knowledge about what each specialty does. So I guess the biggest misconception is that podiatrists aren't as knowledgeable about certain things as the DO and MD counterparts, which is not true. We do the same. We have the same courses for the first 2 years of medical school, and then in our third year, we branch out and do more things tailored towards the foot and ankle. So we'll have a second anatomy course, and we'll have other surgical courses, whereas your other MD DO counterpoints will have more specific courses towards the other specialties, like if you want to be an OBGYN or if you want to do emergency, they all have more of those kind of rotations, where our rotations are very specific. So that's pretty much the only difference. Our first 2 years of training are essentially the same, and then the last 2 years we specifically focus on the foot and ankle.
Got it. Good to know.
Yeah.
Okay. So what does your typical day look like?
So I'm an independent contractor. I work with two other people who use the office spaces. So it's not just me in the practice. It is my charge to, they opened a brand new office, which I am now charged to increase patients with. So with that said, it's been actually pretty good. I mean, I'm at 2 office locations. One is in Irvine, and then the other one is in Orange, California. The one in Irvine is the main hub for the clinic. So when I first started in July, I was seeing a lot of like leftover patients or overflow patients, if you will. Patients who wanted to be seen quicker but couldn't get in with the other doctors. I would see them. But now, heading into September, it's been pretty much a lot of new patients since I'm kind of making more of a presence in the area. The new office that's in Orange, it's also starting to build up. That's been, for private practice, it's a lot about networking. So that's been a lot of what I've been doing at the office in Orange, making connections with other family medicine doctors, internists, anybody who's in the same building I am, actually.
Yeah.
Well, they'll know that a podiatrist is in the area, and if you have patients that have foot and ankle issues, that I'm here. So
send them your way.
So it's been actually growing pretty fast, faster than expected, which is awesome, So
that's great.
It's been good, yeah.
So on your day-to-day basis, what time do you get into the office? What does your day look like?
Right? Yeah. So it kind of depends on the day, but as a general rule, we have clinic every day, Monday through Friday. Clinic is usually between either 7:30 to 3 or like 9 to 4 kind of thing. And that gives me wiggle room to book my surgeries either before or after clinic. I usually like to do surgeries early in the morning, either like from 6 a.m. to, ending at 9 a.m. So that way, we have patients not eat the night before surgery. So that way they like me, so I can give them breakfast afterwards. And then I can go to clinic and see other patients. So Yeah, and I like it that way. So that way, the practice is essentially, 70% clinic, 30% surgery. And that's good because you're also seeing your post-operative patients and things of that nature in the clinic. So for me, that works out perfectly. I'm not always in the clinic. I'm not always in the OR. It's
you
just
get a good balance.
Yeah, it's a good balance.
Nice.
So, yeah.
So with all the time that you spend at your job, what is your favorite part? And then what is your least favorite part?
Oh, okay. So I picked podiatry because I actually like it. Like, the favorite part is that a lot of things can be done for patients who have foot pain. If a patient comes in with foot pain, there's like a high percentage chance you'll leave with less pain once you come to clinic. People are generally pretty happy after coming and seeing the podiatrist.
Sure.
It won't be, there's usually something I can offer. I can either offer a procedure the same day that you see me. I can offer you some medication that can probably kick in really fast. Patients are generally happy. So the best part of my day is making people happy. That's good.
Yeah.
Can't, win them all, essentially. Right. There's always, patients who don't really get a good diagnosis, and it's just kind of, you have to work with those patients a little bit more, but generally it's pretty rewarding. Gosh, the thing that I don't like, that's a tough one, but I think the thing that I don't like is just not being able to work with patients' insurances sometimes. That's kind of been a bit of a barrier. I hate knowing what the patient needs and not being able to get it to them. And it's kind of like I'm not really well versed on any of that, so it can be kind of challenging. So I think the business part of it has been just a little bit of a hurdle to get through, but otherwise I'm pretty happy.
That's good. That's good.
Yeah.
So what advice, Dr. Vincent, would you give to students who are entering the profession?
So I would, gosh, there's so much advice.
You can give more than one piece of advice.
I think that I definitely would say that you have to remain focused on the end goal. It is a very challenging experience. Medical school tests you very much, literally and figuratively, tests are coming at you every week, and then your mind will be tested like, oh man, I don't know if I can handle this. I don't know if I can do it. But at the end of the tunnel, like there is more light, and it's going to kind of seem really, really darkest before the dawn because, residency is no easy feat either. You're, overworked, lack of sleep, there's politics involved. But that's for anything. That's for MDs, DOs, DPMs across the board. That's just, the nature of medicine in general. So, in general, if you're going into podiatry, DO, MD, whatever, just my advice would be to, remain focused on the end goal because it will be rewarding. It is worth it. Yeah.
That's good. I remember being in school and having those dark days where I was like, what am I doing?
Yeah, why?
Am I going to get through this? But
I just want to go home.
You push through.
Yeah, you push through it.
Okay. You touched on this before, but I want to ask you more specifically, is there a particular patient that really left an impression on you or what's been your most memorable experience with a patient?
Oh gosh, there's a lot. So in residency there was a lot of interesting memories, but I guess my most memorable patient would be the one patient that I saw most frequently.
Okay.
There's a large portion of podiatry that is dedicated towards our diabetic population. And with the diabetic population, there are lots of wounds that happen and you don't want the wounds to get infected. I was fortunate enough to receive this patient in the emergency department.
Okay.
Had a foot infection and I unfortunately had to amputate part of his toe. But thankfully, he was septic and he was just not looking good. So in order to save his life, you have to take the toe.
Right.
And fortunately, I was able to see him throughout his journey in the hospital and then post-operatively afterwards, and kind of see the progression from somebody who was out of control, raging diabetic with a wound and infection, to someone who was a little bit more healthy. He actually got on a good, regime with his family physician in regards to his diabetic medication. And he started working out. He lost weight. He got better shoes. He got the progression that you can have when you have a good relationship with your doctors is
makes a difference.
It makes a huge difference. And, when you're willing to listen and kind of follow protocol and make sure that you're following the steps, it makes a huge difference in a person's life. We're talking about somebody who could have, refused the surgery in the initial visit, who could have just passed away, in the hospital, to someone who now is very health conscious. He's working out and going to the gym and doing all that kind of stuff. So that was my most memorable patient while in residency. So.
That's great. I'm sure that's very rewarding to see the progression.
It is.
From not so good to much, much better.
Much, much better. Yes.
Okay, I think I know the answer to this, but I'm going to ask the question.
Sure.
Would you recommend the field of podiatry to other students?
I would. I would recommend it to other students. I think you definitely need a shadowing experience to be sure that this is a career that you want.
Right.
Not all aspects of podiatry are pretty. Obviously, people have really interesting feet. Not everyone likes feet. And people have that thing too. What do you have, a foot fetish or something? I'm like, no, not at all. That's not at all what the case is. It's just, I like being able to help people. And if those people happen to have foot problems, then that's what I'll fit.
Them.
Yeah. So, I absolutely recommend the field of podiatry. I think you have to have, pretty good dexterity skills and hands, as well as pretty high level of intelligence to kind of go ahead and diagnose and treat patients. But it's fun. I think it's fun if you like people, if you like fixing things. It's a good career.
Good.
Yeah.
Excellent. Good for students to know. And that is a theme that I've heard before, is shadowing is critical. Mm-hmm. And students should definitely do that to kind of get a flavor and see if they could see themselves doing it.
Yeah. Yeah, definitely. And you also, I think you have to look at the physician's lifestyle, not just the medical part. I think it's good to know, your job is only one aspect of your life.
Right.
There's other things, hopefully, that you have about your personality.
Yes.
That doesn't include, your job. So when I was shadowing, I was kind of looking at the work hours. I was looking at, okay, I'm a woman, eventually I want to have a husband and kids and things of that nature. Am I going to have time to do any of that if I'm going to be bogged down with a bunch of patients every day, 24/7? And with podiatry, I did not have one concern about that. I saw there aren't very many women in the field, but the women that I did see in the field, they had kids, they had husbands, they were on vacation, they were happy,
Mm-hmm.
So there's that other aspect of life that also has to happen, which I think is in particular kind of important for a woman. So
definitely.
That's when I kind of extra decided, okay, this is it,
So podiatry gives you a good work-life balance.
Absolutely. Yeah. I am rarely on call. And when I mean rarely, it's maybe once a month or every 2 months. I don't work on the weekends unless there is an emergency with one of my own patients that I have to see in the hospital. And that's never a burden because that's someone I've been following, So yeah, I can go anywhere on the weekends. I'm not bogged down.
That's great.
So I am, it's a good lifestyle career balance. Yeah.
Good to know.
Yeah.
Next, what I want to talk about is the investment that you made in your podiatric medical school education.
Right.
So obviously it's a big investment in both time and money. Mm-hmm. So how did you go about making that decision that this was something you were willing to invest in, and how has it played out, since finishing school?
Right. So if you are embarking on any medical field journey, it's going to cost you a pretty penny, not just for tuition of, the actual medical education, but even before you get to medical school, MCAT preparatory courses, the actual MCAT, which most people take more than once, those all cost a lot of money. So you have to know that you're willing to invest in the time. and also the money.
Right.
I was fortunate that I didn't have to pay any undergrad or master's bills.
Okay.
So my medical school debt is just medical school. That was it, and even still, I'm like, whoa, that's a lot of money.
Yeah.
But now that I'm out and I'm practicing and I'm, speaking with financial advisors and, things of that nature, like I don't have any anxiety over it. I
Sure.
mean, of course you look at those, my federal student loan bills every month and go, oh geez, what did I do to myself? But, when you get your job and when you start getting those paychecks, it'll all make sense as to why you did it. So it gets kind of, like I said, more like darker before the dawn still, because even in residency, you're having to spend more money for boards, more money for applications and licenses and DEA license and whatever you need to start your career as a podiatrist. Like all of those things still cost money. And I remember, going in May, it was past May actually, because I was like, starting my job, going, oh my God, like this is just, it's just never ending.
Yeah.
Never ending money pot. But now that I'm on the other side of that, it's now September, I am content and very happy with what, my decision was. So
good.
It's, and we can go into specifics later on if you'd like. I mean, it's not something that you want to talk about initially.
Yeah, no, I completely understand. And we don't have to go into specifics. Yeah. But the other question I wanted to ask is sort of on the flip side of that. Are there ever any scenarios where you think maybe a student should really think long and hard about making that investment?
Yeah. Well, I will say this. There were times where I wondered, kind of like scaring myself a little, like, oh my gosh, if I don't pass Part 2 boards, then 2 years of education or 3 years of education would have just, been out of the window. I would still be responsible for my medical debt, but I wouldn't have the nice, pretty job afterwards, So that's something that I think everyone kind of mentally goes through. It's like, okay, if I don't pass these checkpoints, then what I've done so far will be in vain, essentially. So I will say, if you're the type of student that at this point in your education hasn't solidified what kind of student you are or what kind of studying person you are, if you're not able to, buckle down after a failure, and like reinvent the wheel, so to speak, and try again, you have no grit, essentially. Like, I don't think that that's for you. I mean, not to say that that's a bad thing. It's not for everybody. Otherwise, everyone would do it. But just kind of knowing yourself, your study habits, and the way that you handle failure, I think would be a good gauge to know whether or not if you would be a good fit for any position in medicine, because it does take a lot of grit. You're gonna be humbled throughout this process. And sometimes it can seem a little daunting, but I mean, if you have that grit about you and just kind of like, okay, that's fine, I will do it this way next time. If you don't have that kind of attitude, I don't think that this is for you, essentially.
Got it. So self-awareness is really important, and knowing yourself and how will you react to a setback is critical.
Yeah, because there will be setbacks. I mean, I don't know one person who's had this picture perfect, journey through medical school. So I mean, you got to have something to get you going again. So that's basically it.
Okay.
Yeah.
Good stuff. Dr. Vincent, do you have any advice for students who are at the stage where they're considering whether or not they want to go to podiatric medical school? Do you have any advice for students who are kind of at that inflection point?
Mostly just to, once you begin, once you make that decision, you just have to continue to go through it. Podiatry is not one of those programs where you can be in your second year of podiatry and say, I think I want to deliver babies instead,
Right.
You can't transfer the credits, you'd have to start all over. You'd have to, even though the curriculum is essentially the same your first 2 years, you still would have to be accepted into the actual like other college, the other MD or DO school. So that's what I would say is just be sure, because it's not something that you can transfer credits or do anything, fancy with. It's just, it's podiatry school.
Once you're on the road, you are on the road.
Once you're on the road, you're on the road. Yeah. Exactly.
Okay. Do you want to talk, Dr. Vincent, a little bit more about the practice that you're a part of and how people can get in touch if they have foot problems and want to come see you?
Yes. Okay. So I am at Orange County Podiatry. We have, essentially I'm at 2 locations. One of them is in Irvine, California. The other one is in Orange. I'm at both places 2.5 days out of the week. I'm currently accepting new patients in the Orange office. To get the address and times of opening and the phone number, you can go visit my website. My website is www.myocpodiatrist.com, and it has all the information on there. If you are looking for information about a foot ailment, I also have, informational videos that you can refer to, and links for certain foot pathologies. I also have a Facebook page. You can look up Dr. Ebonie Vincent, DPM, MBMS. And the same information that's on my website is on my Facebook page, which is good. And then you can also find me on Instagram at dr.ebony. That's dr.ebonie. My Instagram page is a lot of information directing you back towards my website, but it's also promoting the lifestyle of a podiatrist. I'm kind of an open book when it comes to Instagram. I kind of gram stuff as I go along in life.
Yeah.
It could be what I do on the weekends, or what I did today. I'm like in clinic today. So
yeah.
It's just kind of like my constant reel of what's going on in life of a podiatrist. So
awesome.
Feel free to hit me up on any form of social media, and you can learn more.
Okay, Dr. Vincent. So final question.
Okay.
If you could go back to your first day of podiatric medical school, what is one piece of advice that you would give to yourself?
First day of podiatry school. What advice? I guess I would sign up with a tutor the first day.
Okay.
No, you don't have to be struggling in a class in order to get a tutor. Most of the tutors that were there were in the Masters of Anatomy program,
Okay.
who had already taken the first courses that you'd be taking. And they are very close with the professors who are distributing the questions. So, going to medical school of any kind is kind of like the analogy of trying to drink water from a fire hydrant. It's like, it's coming at you so fast. You're just trying to get a sip,
Yeah.
So getting a tutor will help you tailor your studies towards what's going to be tested and what's important. And I would totally do that my first day and be like, okay, I just had like 3 to 5 hours of an insane amount of information. What should I focus on?
Right.
Like having that kind of advice earlier on would have saved me a lot of anxiety and worry.
That's
just because there's just so much information coming at you. Like there's no way that you can learn it all within the time period of them testing you on it. But it is important that you do well on your exams. And then the rest of the information you'll, eventually learn when it comes time for board exams and all that good stuff, but the majority of it is you need to learn up front, which is the most important.
Got it.
So that's the advice I would give to any student. Get a tutor.
That's smart.
Perfect.
I like it. It's smart. Use your resources and have a support system.
Yeah.
It makes
so much sense. I wish someone would have told me.
Don't be afraid to ask for help.
Exactly. Even though the first test hasn't happened yet, you need help. You just don't know it yet.
Okay, well, Dr. Vincent, thank you so much for coming and sharing your insights with potential future students.
Thank you so much for asking me to come.
Thank you for listening to eQuez Audio. To learn more about podiatry and to explore schools, head over to eQuez.com. That's eQuez.com to get personally matched to best fit programs. If you enjoyed listening, be sure to subscribe, and we would love for you to rate and review us. Keep in mind that our discussion today mentions views and opinions that are personal in nature and do not necessarily reflect the official policy or position of any university, agency, organization, employer, or company, and should be used at your own discretion. We wish you the best in your quest for education.